Hi friends, so today I am going to try to talk about some dietary changes that we can make to optimize our cardiovascular health. This is a kind of a difficult topic in a sense that there's a lot of dietary advice out there, especially in YouTube, and people are confused as far as what to eat. At the same time, nowadays a lot of people are aware of what is good and what is bad. For example, general population already knows that high salt is not good for you. General population already knows that high fat containing foods, highly sweetened foods are not good for you. ഈ കാര്യങ്ങളൊക്കെ നമുക്കത് obvious ആയിട്ട് തോന്നുന്നുണ്ട് ഇപ്പോൾ. Hey, but in the past people didn't know that, and now people know all of these things. So there are dietary recommendations. So what I'm going to focus on is what the official medical society recommendations are in regards to diet. And official recommendations are not very specific. It is general. Okay. Official recommendations are somewhat general. So for cardiovascular disease prevention, one of the things that a patient needs to know about is decreasing their cholesterol levels in their body. Okay, we all know LDL, low density lipoprotein, is not good for you because it causes atherosclerosis or plaques, cholesterol plaques in the arterial walls, which can lead to heart attacks, strokes, and things like that. So cholesterol korakkunnathu is important, we know that. And so therefore, how do we do that? So one thing is that instead of cutting things away from diet, which is reasonable, the first approach should be to add things to the diet. One example would be adding more veggies and more fruits and legumes, nuts into your diet, and slowly reducing high fat items from your diet. So that I think that would be an easier approach rather than going on a cutting spree. And once you get your body used to eating more veggies, more fruits, then it'll be easier to cut things off of your diet. Example, if you're used to wanting a sweet item after your meal, it'll be challenging to cut that off completely because as human beings we have certain weaknesses and it'll be hard to cut that off. But on the other hand, if you started adding maybe an apple slices or grapes, cantaloupes or something like that, instead of eating ice cream after your meal, then our body will get used to eating the apple and slowly you'll be able to get rid of the ice cream and things like that. So important things is high fat, high sweet items we need to get rid of in our diet because they are not good. Soft drinks as a whole, not a good thing for you. Any kind of soda items and things like that are full of sugar that is very useless calories essentially. Avoiding red meat altogether is important. Okay. So the other things, lifestyle changes that we can make is also physical activity, adding physical activity to our daily life. So what is the official recommendation? Now these official recommendations are, like I said, generalities. They recommend that everyone should have at least 40 minutes of moderate to vigorous physical activity 3 to 4 times a week at least, okay? And that can be, so that's moderate to vigorous depends on you as a person, because what is moderate to vigorous for me may not be anything to you at all. For me, it may be just walking a little faster. For you, it may be jogging. So you have to gauge where you are and start that activity. Okay. So in regards to high blood pressure, coronary disease, things like that, physical activity important to start adding daily physical activity in your life. Also changing the dietary habits in your life is also important. A couple of things about blood pressure again would be increasing fish in your diet. American diet is a lot of the times a very low amount of fish. People are eating more beef and chicken, but increasing fish is important and has shown to be beneficial for overall health and as well as to decrease cardiovascular risk and high blood pressure. Some of the things that patients ask me also include, what about supplements to decrease my blood pressure and things like that. There's some beneficial evidence out there in potassium supplementation and magnesium supplementation, but from a physician's perspective, I have not given people just potassium supplements to control their blood pressure, but it's something to think about. Having low potassium in your diet can actually worsen your high blood pressure. Having low magnesium levels can also worsen your blood pressure. But if you are going to supplement potassium in your diet, you have to be careful, because some of the medications used to treat high blood pressure also increases your potassium levels. ACE inhibitors such as lisinopril, things like that, increases potassium levels. Some people have are on or have chronic kidney problems that can actually cause problems if you supplement with potassium. So before doing supplementation, I think it's important that you talk to your doctor and get a general idea and then start things like that. The other thing I want to talk about is high fiber. High fiber is good for you, and a fiber-rich diet has been shown to decrease cardiovascular events as well as improve blood pressure. So all of these things sound pretty obvious, but at the same time, putting it into practice is very important because it decreases your cardiovascular risk in your life. So to recap, increase your fruit intake, veggies, nuts, decrease red meat and high saturated fats, decrease sweetened beverages, high sugar food items and things like that. Okay? In regards to weight loss, obviously weight loss is important for both high blood pressure, treatment of heart failure, etc. So keep your weight in check. Alright, this is just a quick update on that. So hope you guys enjoyed it. Thank you.